Hey, Dr. Smith, how you doing?
Good. Nice to see you, Michael.
Yeah, no, I'm looking forward to a great day. I think we have 5 full implants today.
Yeah, 5 full implants, and then I got a couple Botox injections afterwards.
I saw that on the board, and you and I have chatted a little bit about that in the past, but I would just want to help, better understand kind of what your thoughts are on where or when you might even actually use Botox.
Well, these patients actually came into the office. They actually specifically asked for Botox. But, in general, I kind of offer both InterStim and Botox, and, let the patients decide which ones they want to move forward with.
So, do you recall offhand what the diagnosis was for these 2 particular patients?
I think both frequency patients.
Hey, all kidding aside, who's the doctor, you or the patient, really?
Well, last I checked, I am.
That's right. So, who comes in and tells you what's going to be best for them?
Mike, I'm not a pushy guy. I don't want to make decisions for patients sometimes.
Sure. No, I understand. So, the other thing I'm trying to better get a feeling for is, what is the actual mechanism of action, for Botox? What's actually happening?
I really don't understand. As much as I don't understand SNS, I think Botox is, just goes in and, just works. I'm not sure, what it does.
Right. Do you have an understanding of what the long-term effect might be? We know what the long-term effect for InterStim therapy is. We have the longer-term data. But what is it for Botox? What is your expectation for these patients 2 or 3 or 4 years down the road?
The reps telling me that, it's not a big problem. There's lots of people using it. And, some guy, Michael Chancellor, stopped in my office and said that, it's pretty safe.
So now you have a patient telling you what they want for therapy, and then you have a rep telling you that their particular modality is going to be best for their patients without any real data to back that up. Come on now, Dr. Smith. You and I have known each other way too long.
I know it doesn't sound good, Mike.
No, no, it does not.
Maybe I should look at it more to really try to understand how that mechanism works, but right now I don't fully understand. I think I understand a little bit. I think maybe it paralyzes the bladder or something like that.
Well, that's kind of what I was angling at, is that my understanding is that it does paralyze the bladder, but I kind of wanted to hear what your understanding of it was, not so much just from the rep, but maybe any research that you've done or peer-to-peer conversations you've had to kind of better understand what the long-term effect is, because I know that you take a great deal of pride in supporting your patients over the long term and certainly offering a full spectrum of care, and I respect that and support that, but at the same time I want it to be evidence-based. I want it to be long-term. I want it to be a long-term solution, for your patients, and truthfully, I don't know that Botox is able to provide that. So I was hoping you could probably shed, some light on that.
The only real evidence is this guy came in, Dr. Chancellor from Michigan, had a pretty lengthy resume, and said he has done SNS, he's done Botox, and they both work equally as well. Both have its pluses and minuses long-term, battery replacement, psych pain.
Right.
Botox, he said, really doesn't have a lot of long-term issues. Once it runs its cycle, it's really out of the patient's body. There hasn't really been any long-term problems, but I haven't seen a lot of papers on that.
Well, the one thing I wanted to bring to your attention is that there was a trial, an ABC trial. It was basically anticholinergics and Botox. And really the sum of that is that there was no statistically significant difference in the reduction against the patient's voiding symptoms, but on the side, it really offered an increased, morbidity rates in terms of, retention, higher PVRs, UTIs. So there was no difference, in the benefit.
If they get a UTI, they come back and see me. That's an extra office visit. That's
more
money for me.
Well, I guess I really wasn't quite thinking that way. And I know we're having that in good fun, but at the same time, if I did look at the data that's available, that puts standard, therapies, say anticholinergics against the Botox, they work equally the same. But again, the side effects associated with, the use of Botox, again, the retention rates, the high PVRs, the UTIs, and then we don't know what's going to happen long term. We just don't know.
You're right. I probably shouldn't be offering this without doing a little more research on, long-term effects and even short-term problems.
I just wanted to float that out there. I want to focus on the great day that you and I are going to have, but at the same time, you know me, right?
Sure.
I can't let someone sneak in the back door without providing some real good clinical evidence to support it.
No, I agree.
All right. So to be continued. I appreciate it.
Thanks for your time.
Thanks, sir.